Thank you, Mr. Speaker. Members, this amendment would bring our tax dollars home to Texas. This amendment would direct the Health and Human Services Commission to prepare and seek a waiver to the state Medicaid plan to expand to the maximum extent permitted by federal law the categories of persons eligible for Medicaid benefits to include all persons for whom federally matching funds are available. Texas has the highest uninsured rate in the nation at 17.8% of our people, and the highest number of uninsured residents at 4.5 million. About 3/4 of the adults who would gain coverage are working Texas families and are people of color. Over half are Hispanic Texans. This amendment would bring roughly $100 billion of our dollars back to our state economy over the decade. It would provide 1.3 million Texans with access to needed care and lower all of our health insurance premiums. But most importantly, this would save thousands of our fellow Texans' lives. I know from my county of Williamson, there would be an annual impact of $41.1 million in federal health care, and 1,985 jobs would be created. Also, 12,190 of our county's residents would immediately be eligible for coverage. I'm sure many of your communities are similarly situated. In addition, Medicaid expansion has produced a net budget savings in many states. Arkansas will save $444 million from 2018 to 2021. Michigan savings will total $1 billion in that same time frame. Virginia, which passed Medicaid expansion just last summer, will save $421 million in the next 2 years. While our tax dollars have gone to pay for Medicaid expansion in other states, Texas continues to have the worst uninsured rate in the nation. We have an unconscionable maternal mortality rate. Right now, 1 in 4 Texas women of reproductive age are uninsured, totaling 1.5 million Texas women. While many of these women qualify for health care coverage during pregnancy, they lose that care shortly thereafter. It is critical that we increase access to health care for women before, after, and between pregnancies by expanding Medicaid. We have failed to keep up with mental health services or address the opioid epidemic. According to a 2016 Department of Health and Human Service report, more than 1 million Texans without health insurance experienced mental illness or substance use disorder during the previous year, and over 400,000 of these Texans can enroll in health insurance if we accept Medicaid expansion funding. We have watched rural hospitals in our rural areas suffer the most. In fact, Texas leads the nation in rural hospital closures, with 19 closing permanently or temporarily since 2013. According to analysis cited by Texas A&M, another 75 rural hospitals are vulnerable to closure. Our tax dollars, your tax dollars, my tax dollars, and every one of our constituents go toward paying for progress in 36 other states. This is our money, and we want it back. While those states have seen a decrease in maternal mortality, better outcomes for mental health and opioid abuse, and significant progress in closing the coverage gap, especially for rural citizens, Texas, however, has continued to fall behind. We are paying these bills for other states while forcing our fellow Texans to choose between getting needed health care or putting a roof over their head, between getting needed health care and paying their bills or getting groceries. We can fix this today. Members, it's time for the state of Texas to join 36 other states, including Arkansas, Louisiana, Ohio, and Utah, in providing millions of Texans with access to health care. It's time to bring our tax dollars back to Texas. Let's stop leaving billions of dollars in federal funding on the table and ensure every man, woman, and child is able to access the care they need.
Representative Israel, for what purpose?
Mr. Speaker, question for Representative Bucy.
Would the gentleman yield for questions?
I yield for questions.
The gentleman yields.
Mr. Bucy, thank you for bringing this to the floor. It's an important issue. You made some great points, but I wanted you to emphasize, who do you think is helped in Texas if we were able to pass this kind of a measure?
Representative Israel, this would help every single Texan. Texas has the highest rate and number of uninsured people in the country. 80% of our 4.8 million uninsured are in working families but earn wages that have not kept up with inflation, leaving them unable to afford health care coverage in the private market. Medicaid expansion is designed to meet the needs of the uninsured yet working poor who have no realistic way to afford full price insurance. These are Texans who are working, doing jobs that are needed in our economy, but through those jobs do not make enough to afford health care.
Thank you, Representative. And what are the implications to local taxpayers? Because I think people think that it's going to cost them more money. Help us make the case in terms of the impact to the average Texas taxpayer.
Thank you. To be honest here, this is money we already pay. We pay for this already. All of us are paying for Medicaid expansion, so this would save us money in Texas. Medicaid expansion would save local taxpayers $4.3 billion across Texas on uncompensated care. It would also create some 303,000 new jobs annually, and $525 million in tax revenue would be generated.
And Representative Bucy, what would be the impact in terms of employment and economic stability? We know that there's a lot of working families who could be helped with this. What would be the impact to them and to the stability of their family?
Look, we've seen in other states statistically, when you have health care, your job security and stability is so much higher. Because when individuals struggle without health care, it impacts all of the rest of their daily lives.
Okay, thank you, Mr. Bucy. Appreciate you.
Mr. Speaker, I move adoption.
Representative Bucy sends up an amendment. It's not acceptable to the author. Does anyone else wish to speak on, for, or against the amendment? Okay, members, we're on the amendment. A record vote has been. Okay, members, no member has come up to speak on, for, or against the amendment, so the chair recognizes Representative Bucy to close on the amendment.
Members, this is something we can do right now that would fundamentally impact Texas. Therefore, I'm asking you to vote for this amendment. I move adoption.
Representative Bucy has sent up an amendment. It's not acceptable to the author. Representatives Sanford, Stickland, and Hefner have requested a record vote. The clerk will ring the bell. I'll give members time to get to their desk to vote. So Representative Bucy voting aye, Representative Turner voting aye, Representative Schaefer voting no. No. Show Representative Stuckey voting no. I don't know what she did. There being 66 ayes and 80 nays, the amendment fails.